Hi all, today we are going to discuss about Guillain Barre syndrome. Guillain Barre syndrome is also known as Acute Idiopathic Polyneuritis. It is an autoimmune attack on the peripheral nerve myelin sheath which prevents normal transmission of electrical impulses. So demyelination of peripheral nerves and some cranial nerves occur. This is neuron and the parts of neuron. When patient is having GBS, it affects nerve in the brain and the spinal cord. Nerve fiber will be exposed because of the damaged myelin sheath. It causes inflammation and degenerative changes in the posterior and anterior roots. Signs of sensory and motor loss occur simultaneously. Because of that, autonomic nerve transmission may be impaired, producing ascending weakness with diskinesia, that is, inability to execute voluntary movements. Patient may have hyporeflexia and parasthesias. Patient will be experiencing a sense of numbness and tingling or a pins and needle sensation. Causes of Guillain Barre syndrome. It is an autoimmune disorder that causes acute neuromuscular paralysis due to destruction of the myelin sheath surrounding peripheral nerve axons and subsequent slowing of transmission. Cell-mediated immune reaction at the peripheral nerve causing demyelination and possibly axon degeneration. The precise cause of this syndrome is unknown, but it may be a cell-mediated immunologic attack on peripheral nerves in response to a virus. Precipitating factors may include mild febrile or viral illness, surgery, rabies or swine influenza vaccination, Hodgkin's disease or some other cancer. Systemic lupus erythematosus event may trigger the autoimmune responses. About 30 to 40% of cases are preceded by Campylobacter infection. It is an acute infectious diarrheal illness. Now let us see the signs and symptoms of Guillain Barre syndrome. Acute onset of symmetric progressive muscle weakness, most often beginning in the legs and ascending to involve the trunk, upper extremities and facial muscles. Paralysis may develop within 24 to 72 hours. The patient may have parasthesias and possibly dysesthesias. Dysesthesias means it is an abnormal sensation that can become intense or painful. Parasthesia means it is an altered sensation including numbness, tingling or pins and needle sensation that are usually painless and temporary. Patient may have facial diplegia, possibly with ophthalmoplegia, ocular paralysis. Diplegia is a condition that causes stiffness, weakness or lack of mobility in muscle. The patient may have difficulty with swallowing. Dysphagia. Patient may also have difficulty in speaking and chewing. The patient may have early signs and symptoms of respiratory failure, including decreased vital capacity, depth of respirations, and breath sounds will be decreased. Inability to cough, inability to lift head or eyebrows. Patient may have shallow respirations, dyspnea, and hypoxia. There are several types of GBS. With the most well-known type, the patient experiences weakness in the lower extremities. Usually, the weakness starts in the legs and eventually reaches the respiratory system, which kills the client within few hours to a few days. Second type is purely motor with no altered sensation. A third type is called descending GBS. It's more difficult to diagnose. It mostly affects the head and neck muscles. The rarest type is the Miller-Fisher variant, presents with ataxia, that is no coordination, hyporeflexia and ophthalmoplegia. How to diagnose the disease? Protein levels in CSF begin to rise several days after the onset of signs and symptoms, and it will be peak in 4 to 6 weeks. WBC count in the CSF remains normal, but in severe disease, CSF pressure may rise above normal. Complete blood count shows leukocytosis and immature forms early in the illness, but blood studies soon return to normal. Electromyography may show repeated firing of the same motor unit instead of widespread sectional stimulation. Nerve conduction velocities are slowed soon after paralysis develops. How to treat the patient with GBS? monitor respiratory function several times daily because the ascending pathology can lead to respiratory failure. If it happens, mechanical ventilation may be necessary. The key treatment is plasmapheresis, that is plasma exchange, which temporarily reduces circulating antibodies, which causes the destruction of neurons. Patients need less ventilator support if plasmapheresis begins within 2 weeks of onset. High-dose immunoglobulins and steroids are also be given to the patient with GBS.